For more than 2 years, people have been suffering because of COVID-19 pandemic. Government units, including barangay officials, are prominent people that suffered a lot during the pandemic as they have to keep on duty even in the presence of the virus. Thus, we conduct a study entitled Challenges of Barangay Aturan Officials Amidst the COVID-19 Pandemic, an empirical study. The importance of knowing the challenges encountered by the barangay aturan officials amidst the COVID-19 pandemic is that it helps to improve and develop the policy strategies of our government, from local to national, for future obstacles that our community may face. We conduct the study with my group mates Mark Levy Roldan, James Pastoral, Gaya Rixi Gamitin, Ruth Troy Ramos, Adrian Lundag, and me, Hannah Rose Barr. General objective: to identify the challenges encountered by barangay aturan officials amidst the COVID-19 pandemic and how they develop their policy and tactics in order to adapt in this trying time. Statement of the problem: 1. What do barangay aturan officials face as specific challenges during the pandemic of COVID-19? 2. How do the difficulties faced by barangay aturan officials during the COVID-19 outbreak improve their policy and tactics? 3. What coping mechanisms did they apply to deal with this problem or issue? Introduction. The barangays, which are still in existence today, are recognized as the local government's smallest unit. It is run by the Punong Barangay, commonly known as Kapitan, which upholds all laws and ordinances, maintains public order, ensures the provision of essential services, upholds rules and regulation on various social issues such as environmental pollution, drug abuse, child abuse, and juvenile delinquency. That is why, when the COVID-19 hit our world, it drastically changed the structure of our government, forcing everyone from leaders to citizens to adopt. As a result, all aspects of our lives have changed significantly. Consequently, the spread of COVID-19 revealed several weaknesses in our healthcare systems, administrative response, and overall nationwide emergency preparedness. Hence, this study is being conducted to examine the difficulties faced by barangay aturan officials and how they cope with the significant change in their working environment, the health risk associated with the COVID-19 exposure, and the threat of danger brought on by various factors during the community quarantine. It is also seek to understand how specific changes and policy techniques are handled. Finally, this study is carried out to outline how these experiences and impacts enhance crisis response planning and policy tactics in the future.
Significance of the study. The study's findings provide a better understanding of how the COVID-19 pandemic affected and challenged barangay officials in Aturan, Santa Cruz, Marinduque. To the residents, they will be aware of the difficulties their community encountered during the pandemic. This will inspire them to assist their community in finding solutions to such issues while also cooperating with them in enhancing their crisis management and pandemic preparedness methods. To the leaders and officials, the outcome may act as a wake-up call for them, allowing them to see what aspects of their policy and strategies need to be improved to handle such issues in their community. The study could also be a stepping stone for future researchers, since they can use this as they may be able to start ideas and bases required in researching the challenges faced by barangay officials amid the COVID-19 pandemic and other related topics.
In finding the related literatures and finished studies, we divided this into 3 topics. First is the barangay officials' duties before and after the pandemic. According to QCG memo guidelines for the barangays in the event of active COVID-19, while the Barangay and Community Relations Department is tasked with ensuring rigorous compliance by all barangays, the Barangay Health and Safety Protocol Officer is responsible for ensuring the implementation of the rules and regulations during this time. As one of the mechanisms of the Barangay Peace and Order Committee, the barangay officials play a crucial role in the advancement and development of the barangay by maintaining community peace and order. Next is the challenges during pandemic. COVID-19 has resulted in a public health crisis. Even the frontliners have been busy because what they have done was dangerous because it will be more difficult for everyone if they will stop working. Government and community leaders face difficult tasks and trials in responding to the COVID-19 problem. The problem with COVID-19 has strained health systems all over the world and widened gaps in the delivery of healthcare services that already existed. According to the World Health Organization, to spread health services into nearby communities, there needs to be more community involvement. And the last one is the barangay officials' response in battling COVID-19. Dudley stated that the lack of preparation led to food and medical supply hoarding among customers, which developed into violence as a result of the scarcity of necessities. In addition to carrying out public health orders, which may include quarantine and travel restrictions, leaders and officials are also responsible to secure healthcare facilities and manage crowds. Moreover, setting up a COVID-19 community response strategy in local government units briefly outlines some policy considerations for LGU. Specifically, provinces, cities, and municipalities currently drafting or revisiting their COVID-19 community response strategy accompanying local measures. Synthesis. The researchers therefore conclude that COVID-19 has put pressure on health systems around the world and complicated local and global government administration. Studies show that barangay authorities, particularly in the midst of the pandemic, play a critical role in the promotion and development of the barangay by preserving community peace and order. Furthermore, community-based health initiatives are generally seen as essential to sustaining health systems in the face of contemporary and complicated global problems. Thus, the aforesaid RRL will give the researchers a foundation and information for this study.
For the research design, the researchers utilized the qualitative approach in acquiring data for the study. Qualitative research, according to Xiang 2002, is a type of systematic empirical inquiry into meaning. It focuses on the respondents' ideas, opinions, convictions, insights, and experiences. This research study falls under the category of empirical, which is the act of learning something by both direct and indirect experience or observation. The empirical design was chosen because it provides a thorough understanding of COVID-19 and how it affects the challenges of barangay official in Naturan, Santa Cruz, Marinduque.
In the research local, the researcher will conduct the gathering of data at Barangay Aturan, Santa Cruz, Marinduque. It will be implemented on 5 barangay officials who all work in the said institution. With that being said, the study will focus more on their thoughts, experiences, and difficulties regarding pandemic.
The researcher will be employed the interview as data gathering tool for this study. The barangay official will be questioned and the personal interview will be used, in which respondent will be personally or directly interrogated. The interview's questions are designed to elicit pertinent information about their respective on the said pandemic and how its affect and challenges them in their capacity as the barangay officials. Additionally, questionnaire will be served as the guide for the researcher when they will conduct the affirmation interview. The primary phase will be preparation and arrangement of all the questionnaire for the interview. The questions should be relevant and connected to the study. The second phase will be the validation and therefore the correction and question. The questions must be straightforward, which we will provide the mandatory data needed within the study. Then the third step is the actual interview within the select the barangay officials who are going to answer our research questions. After conducting the interviews of all obtaining all necessary data, it will be collected and immediately will be subjected to analysis and evaluation.
Ethical consideration. An ethical viewpoint on the research process is necessary for ethical research. In qualitative research, we follow 4 ethical principles: voluntary involvement, informed consent, anonymity, and confidentiality. We should consider these 4 ideas in light of this research investigation. The participants or respondents, particularly barangay official, will be protected to maintaining their anonymity and confidentiality by not disclosing their names and identities during the data collection, analysis, and publication of the study's findings. Hence, the interview, environment, privacy, and confidentiality will be rigorously safeguarded throughout the interview. data processing and distribution of the findings. In addition, when using the informed consent and voluntary participation strategies, consent must be fairly given. Voluntary individuals must be understand what is required of them, and those participating must be of legal age to offer their assent. This means that in order to take a part in a research study, participation must be sufficiently informed about the study, understand the materials, and have the freedom to make their own decision.
And this is our presentation of our study. Let's all be aware that COVID-19 pandemic is not yet done. Thus, helping and cooperating with our government officials should be continuously done. Thank you for watching.